Coming up, we will be on location at Nova Spine and Injury Center in Fairfax, Virginia, discussing the latest advancements for treating injuries of the shoulder, elbow, and wrist that cause debilitating pain to millions of people with one of this area's top doctors of chiropractic, Dr. David Schaefer. Dr. Schaefer graduated from Palmer College of Chiropractic West and is one of the first chiropractors in the country to receive the prestigious certification of Advanced Practice Chiropractic Medicine. He has treated professional athletes from every major sport as well as Olympians. Welcome, Dr. Schaefer.
Well, nice to see you again here, Rocco.
Yes, indeed. It's great to have you back on with us. We've got a lot to talk about, so let me just begin by asking you if you can please tell us what are the typical types of problems that people experience, whether it be with their shoulder, their elbow, or their wrist?
Well, probably the most common injury that we have are tendonitis-related injuries. These are injuries related to overuse, typically, or doing things improperly. Carpal tunnel is also a very common injury to the wrist that we see on a regular basis, as well as rotator cuff injuries that can go from tears to tendonitis also there also.
The baseball players, pitchers, in fact, have those quite a bit.
A lot of overhead athletes have a lot of problems to the shoulder and elbow. And in my past, I did a lot of work with pro athletes, and we had these on a daily basis.
Now, obviously, these are problems that millions of folks experience, unfortunately, and I wanted to ask you, why are they so common?
Yeah, you don't have to be an athlete to get a problem in your upper extremity. They are so common mainly because of the repetitive tasks that both people's work and hobbies cause them to do. And specifically regarding the shoulder, a lot of these injuries are related to the biomechanics of how people are performing tasks in their everyday life. A lot of times people have weak muscles that support the scapula, and when those muscles are weak, their shoulders round, and now their rotator cuff musculature are pulling at angles that they shouldn't normally pull, and they're doing this in a repetitive nature, and this can eventually cause microtrauma and overuse and cause pain.
What treatment options are available that can certainly eliminate or at least help alleviate the pain?
Well, there are many treatment options available. The last case scenario would be a surgical procedure to any of these areas. We try to treat things conservative before you even consider a surgical option.
Surgery is always the last resort.
It's always the last resort. So in this clinic, we typically do a lot of soft tissue protocols called myofascial release, as well as taking things through a range of motion to increase range of motions, lengthening tissues. We use a lot of high technology like our cold laser therapies, and ultimately the thing that's going to keep all these things away is a good rehab and strengthening protocol.
And how soon after one begins treatment would a patient typically be looking at as far as the length of time before they start feeling better?
Many times the length of time that patients are suffering with a condition can be a determining factor on how long they're going to need treatment. Unfortunately, with these repetitive trauma issues, there's a lot of scar tissue that will develop, and we have to get rid of some of that scar tissue to free up those structures so that the pain will eventually go away.
So if a patient obviously comes to their chiropractor in a really bad condition, as far as whether, let's say it's a shoulder injury, for example, and they felt the pain and they've had the pain for quite some time and it just progressively has gotten worse, then if they come to their chiropractor in that condition, based on what you just said, it would take obviously a bit longer after treatment has begun, before they would start feeling the relief, as opposed to somebody being more proactive, and when they first start feeling that pain and it stays beyond a few days, whether it be the shoulder, the elbow, or the wrist, and then they go to their chiropractor, since they came to the chiropractor much earlier, higher probability that the relief would be felt literally immediately or shortly thereafter.
Many times with these type of conditions, immediate pain relief is not always a possibility. Because these are tendinous injuries typically, tendons and ligaments have very poor blood supplies, so they are slower than normal healers. Muscle injuries go away very quickly, so if it's a muscle injury that's related to the rotator cuff and it's not the tendon, that will clear up relatively quickly within a week or so. Tendon injuries can go anywhere from 4 weeks, and I've seen them last to 12 weeks. Depending on the condition. There's many ways of combating these. The higher technologies of using cold laser have really helped to speed up healing times. And where injuries where I would see that lasted 8 to 12 weeks, I'm now able to kick out in 4 to 6 weeks.
It's reduced the time dramatically.
No, it's been amazing, and it's really the only thing additional that I've added to my therapy, so it's definitely showed effectiveness.
Would the results be permanent for the patients after they've undergone all their treatments?
Well, permanency is always a complicated issue. Anytime someone is injured one area, they have the propensity to re-injure that area more easily. But if patients are proactive and they do the things that are necessary, like keep up with the exercises and work on their positioning when they're performing the tasks, whether it be sports, work-related, or just their hobbies, by doing things correctly and in the correct form, they can prevent a lot of these injuries from returning. But really, it is situation to situation, so we can't really tell you is it going to be permanent or is it not going to be permanent. Many of my patients don't return for more treatment.
Which is good.
Yeah,
that means the pain is gone.
Every doctor, their goal should be not to see their patients again. They should give them the skills and the ideals that they need to take with them in their everyday life to prevent that pain from coming back.
How many treatment sessions is one generally going to be looking at? I know it depends, again, based on the injury and the exact prescribed treatment option that their chiropractor would offer them, but what is one typically looking at as far as how many sessions?
Well, typically treatment is conservative care, so treatment is more often and for a little more of an extended period of time. But typical patient with these type of things will be seen 3 times a week for the first week and possibly into the second week, and then 2 times a week thereafter, moving down to 1 time a week, anywhere from 2 to up to 6 to 8 weeks, depending on the condition. Like I said, I don't have cookie cutter treatment programs here at Nova Spine and Injury. We treat patients individually, and by taking a patient and seeing how they're improving and what they need to do next, it's going to determine how long the length of treatment is. So when you come in here, I don't say, you need 20 treatments. I look and we are constantly reassessing what's going on with your condition and moving you along as quickly as possible. Because I'm sure you're a wonderful person, but I want you out of my clinic as quickly as possible.
And feeling a lot better when they leave the clinic.
Of course, well,
yes.
That's always going to be the final.
So it sounds like you're talking about a personalized care approach which you and your organization utilize that certainly is based specifically on that individual patient and his or her needs and the pain and the area of the body that they're suffering that pain, and then developing a strategy and a treatment option of which you've discussed here today to let us know what's available in remedying the problem.
Well, most definitely. Every patient's going to be a little bit different. Now, there are going to be similarities in treatment based on what type of condition it is. But the same person could come in with the exact same condition and things are going to go a little bit differently. So you have to be open enough as a practitioner to recognize those things and be able to tweak the care here or there to make it more effective for that particular patient.
Well, that's in fact goes along with what we've heard and seen and found in our research about you and your organization, is that you have developed certainly a very strong reputation in the field of chiropractic care, and the reputation is certainly well earned with the approach you utilize. And today, after what you've just mentioned here in the last few moments, I can certainly get a better perspective of what separates you and you from the others in the chiropractic care field with the approach that you all utilize, and then it drills down from there based on what you just described.
Yeah, we don't operate a people mill here. Patients that come in here with problems get a lot of personalized care, a lot of one-on-one, face-to-face time with me personally, both through the individual treatments and through the rehab section of their care. It's important for me to be very involved with my patients' care, and that also incorporates low wait times in the lobby and things like that. I don't like waiting at a doctor. I try not to make my patients wait at the doctor also.
That's right. Well, they get to meet you here, and you work on them as opposed to an assistant or an associate, that obviously, which happens at some other chiropractic care clinics in the area.
I employ very friendly folks, but
yes.
People come to see me, not them.
How safe are the treatments you've discussed here today, Dr. Schaefer?
Oh, about as safe as you can have for these type of conditions. There is no invasive treatments whatsoever. Everything is conservative and working on improving biomechanics, increasing strength, and just improving function and reducing pain at the same time.
Only a few moments left, and I have to ask you before I let you go, any final thoughts for our viewers?
Just like any condition, do your due diligence and look at the practitioners that you're thinking about going to see. Make sure they have a background in treating the conditions that you have, and even interview from time to time more than one doctor and see who's really going to be the best option for you. Just choosing the doctor that's in your insurance plan really isn't the best option.
Very well said, and on that note, I'd like to thank you, Dr. Schaefer, for joining us and being a guest today on A New Me.
Thank you very much, Rocco.
It's our pleasure.